So you're at the gym and you see this girl doing this exercise. And when she's done, she comes up to you and asks, am I actually using my rectus abdominis muscle to do this hanging leg lift exercise? What would you tell her? Would you say yes or no? And why? Well, the rectus abdominis is going to have attachment points to the pubic symphysis and the pubic bone, and also to the costal cartilages of ribs 5 through 7 and the xiphoid process. What that means is that the rectus abdominis does not cross the hip joint. Therefore, this movement alone, flexion of the hip, is not caused by the rectus abdominis muscle. However, built into this exercise, there are components of trunk flexion and requirements of posterior pelvic tilt, both of which would utilize the rectus abdominis when it is contracting, specifically the lower portions. So to answer her question, yes, she is utilizing the rectus abdominis muscle, but it is not to do the actual hip flexion portion of the movement, but the trunk flexion and the posterior pelvic tilt. The prime movers for hip flexion are going to be the rectus femoris and the iliopsoas muscles.